We're back to Neil Haley Show, and my guest today is Ani Papazyan, and she is a highly experienced pain resolution specialist with close to 3 decades of expertise in the field. And I appreciated, Ani, you coming by, and that's a huge thing, pain resolution. Can you define that for me?
Hi, Neil. Great to be here. Yes, one of the things people usually say, oh, so you do pain management. And when I hear that, I just get this cringes. I say, I don't manage pain. I either resolve it or I don't. There is no management. That's what most doctors do. They manage your symptoms. They manage. So I get rid of body pain, chronic pain, using different modalities, but don't manage it.
And that's huge, okay? Right? Because what it shows you is that if we're just going to say, manage pain, the pain's never going to go away. And pain leads to so many more things. It's the beginning process of your body shutting down, isn't it? Pain, chronic pain. Wouldn't you agree? And that really deteriorating, and we're not doing the right things if we're feeling lots of pain.
Yeah, and it's also your body's way of saying, hey, I need attention. Something's off. So it's a good thing.
Exactly. And we wish that we can just, when you go to a doctor, you come up with a laundry list of things that say, hey, I need help in this, need help in this, and this. I wish we can look at that. We all think that the older we get, the more we can be in pain, which is, it's a shame, right?
Well, that's one of the things, when I go to a bunch of networking events, that when I start introducing myself, that's the first thing I say. I work with people that have been told their body pain is normal for their age, because I can't tell you how many times I've heard from my patients saying, oh, as soon as I turned 40, the next day I woke up with this pain and that pain. Or saying, as soon as I turned 50, the next day I felt this pain. So it's like, yes, once we get older, you may feel pain, but it's because in our 20s and 30s, we just abuse our body because we can recover so much faster. And the analogy I use is, think of it putting the dust under the rug. It's going to be looking okay for a while, and then after a while, you're going to see that little curve. It's the same thing, our body. There's only so much we can endure.
So give me some tips that we should look at regarding trying to reduce pain and eliminate it. What things should we look for?
Well, one of the biggest things is, regular headaches, joint pains, muscle pain. You don't recover fast enough that you used to. Or the biggest thing is, as you know, is the inflammation, having a systemic inflammation, sugar cravings. There's so many things that you can look for, but the biggest thing is the inflammation. And I love to start with your eating habits. Your eating habits, even if you go exercise, do all the stuff using the clean products and things like that. But when you're not putting the right stuff in your body and you're just adding, what they call the thing into the fires,
yeah,
then it's, you're burning from both ends.
Right. And it's so many different things that are not told. We always put ourselves on a medication and that's the great thing of working with an organization like Patient World, that we're really looking for other alternative solutions for patients. And that's an amazing thing. We're going to talk about the summit in a second. But I think you're right. Proper dieting. And I'm on my way at certain times, other ways not. Exercising, and it could be even walking, but really keeping yourself active, but ultimately monitoring your body for pain. Monitoring if you see certain things are not right, we can make these changes. We can change things at an older age. It doesn't mean we just have to go to the doctor and say, doc, a lot of people, well, okay, I'm dealing with all that, I'm just going to go take these meds. No, let's figure out ways that we can eliminate, gone. And that's where I hope medicine goes someday, right, Ani? That we get to this point where it's no longer about putting a Band-Aid on something. Hey, I got a pill for your anxiety. Hey, I got a pill for this. I got a pill for that. we have a solution to eliminate it. That's my hope.
Believe me, mine too. My goal is, that's why my new direction in my business, for almost 3 decades, I've been working one-on-one. But in the last couple of years, it's all about, I want to do more speaking, get on podcasts, on summits, to share the message that you should never learn to live with pain. I love using this quote: pain is inevitable, suffering is optional.
Yeah, totally.
Knowing self-help techniques, that's what I love. Like a few months ago, one of my clients, I woke up in the morning and she sent me email saying, my 14-year-old son woke me up in the morning with early middle of the night with neck pain. She goes, I remembered a couple of the techniques you taught me. I walked him through and they worked. She was so excited and so proud of herself. So imagine if you know some self-help techniques that you can use right away, and so that discomfort never converts into an actual pain.
That's fantastic. That's exactly what I'm talking about. Those things are the great things. I have a client that is able to eliminate concussions and stop the things, and that's what I want. I desire to work with people that are changing and transforming lives, like Dr. Hester, not looking at the patient as, okay, we just have to treat the problem, but we're treating it. We're not eliminating it. And that's what you look for. And so you're excited about the summit coming up. Tell us a little about the summit, how excited you are about the Patient World Summit and what you're going to be speaking. Mm-hmm.
Oh, yes. Oh, my God. I honestly, I didn't even know I was going to be in there when I was talking with Dr. Hester. I thought we were setting up Zoom call. And then she's like, oh, no, you're going to be like in a summit. You're going to be doing your talk. And it was so much fun. I'm so looking forward to it. And I can't wait to hear other contributors, other speakers, like there's so many people out there that truly, genuinely want to help, giving their time, their gifts to the world. All we have to do is just find people and put it out there so people can hear that message.
And the best place is go to patientworld.net to find out when the summit is. And you're going to be speaking your signature talk. And what is your signature talk on?
It's on empowering your journey to pain-free living, where I actually share a couple of self-help techniques that you can, as soon as you watch the video, you can use it and see the results right away.
All right. We appreciate it. Best place people can find information on you is go where?
My website, Last Stop for Pain, and 4 is the numeric 4. And I do have some free resources people can download and have access to it. So yes.
We appreciate you coming by. Great information. And you really are telling us exactly what we need to do to finally eliminate pain. Appreciate it, Ani.
Thank you so much, Neil. Thanks for having me.
You're welcome. You're listening and watching the Neil Haley Show, and we'll be back in just a moment.